Hi, everyone. It's Stephanie with the Patient Story, and I'm so excited to introduce our guest today, Nina, who I can't wait for you all to meet. But first, Nina, I just want to say thank you so much for taking the time to share your patient story with us today.
Thank you, Stephanie. I'm so looking forward to this.
We were able to connect through mutual friends, and I've been looking forward to this conversation. I know it's pretty fresh still for you, actually. But before we jump into the cancer story, I really love having people just sort of introduce themselves outside of the cancer context first.
Absolutely. Well, I'm actually repping my alma mater, but I grew up outside of Philadelphia. I was on the women's rowing team at Radnor High School and then went to college at the University of North Carolina, where I was on the Division I women's rowing team. I studied advertising and entrepreneurship. I then actually transitioned to New York City. And that is where I started both a nonprofit called Women in Sports Tech, as well as got into the sports tech landscape myself through my first full-time job. And this is where I spent the last year and then have been in New York since. That's where I'm currently located. And I'm 25 years old. And that's kind of a brief highlight reel of my last 10 or so years.
That was very well done, very succinct. And I love it because as we were talking, it was actually pointed out that you are wearing the same sweater
I
as this photo.
know. So funny. I look very different, but yes, I am. That is same sweatshirt.
And it's so impressive. I'd love to hear a little bit more about look at this crazy photo. Does this conjure up some good memories for you?
Oh, both good and bad, I'll be honest. I mean, rowing is a not so glorified sport. It looks beautiful, but it is grueling. Really early mornings, you'll see in both of these pictures, just a lot of emotion. There's a lot of heartbreak when it comes to trying to work through the schedule and being a student athlete, especially with rowing. Um, and I had a lot of success, but I actually had to medically retire my junior year because of a hip injury. So I did have my senior year to experience college in a more normal format.
That's good. Yeah, that's actually the untold story, right? Is all the grueling hours and the less glamorous side. But I imagine your experience training so hard and having to be resilient in a lot of ways may have
Mm.
contributed to how you were able to move forward when you were hit by this crazy, overwhelming situation that we all know as cancer.
Are spot on. I took more lessons from my rowing career and what I had to endure then every single step of my way during treatment.
Okay. Well, I can't wait to hear more about that. This first video for everyone, it's going to be about how Nina learned about the cancer and those first weeks of tests and scans and waiting for answers. And so, Nina, how did you know something was wrong? What were the first symptoms, so to speak?
Yeah. So to start, I didn't know anything was wrong. So about January of 2020, I was doing a Pilates course. Now, as a student athlete, I know how to really work myself. And I was doing the most simple exercise. And I tweaked my hip, which I did just reference. I had some hip injuries in college. So really nothing was alarming. I was just like, well, I might have pulled something again. And I gave myself a lot of rest. So this hip injury of doing the Pilates manifested into growing from my hip down into my legs, into my calves. And it was just excruciating pain. I went to a physical therapist 3 times a week. And each time I went to visit, it progressed worse. And I wasn't doing anything wrong. I wasn't over exercising on it. And I felt so shameful that I was making such a big deal out of something that I couldn't pinpoint. And these symptoms just got worse. It went from lower extremities into upper extremities. It felt as if I was sore in every cell of my body. And it wasn't until it really manifested into my chest is that's when I became more alarmed on this could be something more serious.
Okay. And so that, of course, got you into this whole let's go and figure this out. So just summarize for us how you went about getting your answers. You go to a primary care first. What was that journey like?
Yeah. So I was in this exact room that I'm sitting in. One evening, I called my dad and I said, Dad, I have chest pain. I've had two occasions of night sweats that were severe, and I don't feel well. And he said, this is not a negotiable argument. Get into an Uber. You're going to the ER. Now, mind you, this was March of 2020 when COVID was rampant. It was just emerging. So, was our concern cancer? Absolutely not. Was our concern COVID? Yes. I went to the ER that evening. This was the first time I'd even been brought into a doctor's office, and it was directly into the ER. That's where I got a CT scan, I got blood work. I was there by myself. Not a single friend or family member was there. And that night, if I could pinpoint the hardest night of my life, that night would be it, because I knew something was so wrong and I had no one and no answers to help me figure it out.
And bringing you back to that really tough time, it's you're alone. COVID's just starting to come out, and you're feeling so vulnerable. How did you, get through it? Because I know every minute can feel very long, and I think people are always trying to figure out how do I deal with this form of anxiety while you're waiting and you're waiting for things to actually come up in terms of answers.
Yeah. So I'm not a big crier. I cried from 8 p.m. until 4 a.m. nonstop, just sitting in the ER room, bawling my eyes out. The ER nurses had so many things on their plate with COVID happening. I was the least of their concerns. And the CT scan and the blood work came back normal. Nothing showed any signs. Now, this is where it gets miracle. My dad, who is in oncology himself, he works for a company called Seattle Genetics, which sells a drug for classical Hodgkin's lymphoma. He had the wherewithal to say, things are not adding up. I am scheduling you for a biopsy the next morning, but I want you to be in Pennsylvania for this. So he picked me up from the NYU Langone ER at 6 a.m. after I'd spent the entire night in the ER, drove me directly down to Penn Medicine Abramson Oncology Center, and I got my biopsy the next morning.
Wow. And was this biopsy the excisional one where you had to go under, and which kind of biopsy was this?
Yeah, so for the first one, I did go under. They took it from my back left pelvic region, which is where they saw some slight discoloration in my bone marrow, but no one was concerned. The actual ER doctors did not recommend me to get a biopsy. It was my dad's advocacy that made me get it. And I was very frustrated with my dad at that moment. I didn't want to get one. I had just been in the ER all night crying. This was not a part of my plan. And the biopsy obviously went super smoothly because I was under during that time. Now, the following biopsy that I had to get, I was not. And that was excruciating.
So this was before you met with an oncologist, right? Because I see in your timeline that was March 3rd. So this is all before the official oncology word really even enters outside of your dad's job.
Yes.
So after that biopsy, the excisional biopsy, how long did it take to get the results, and did you learn something then?
So I actually went back to New York because I got the biopsy. The doctors said, we are not concerned that this is anything. We got it because your dad asked for it. go back to New York, continue working. So for the next couple days, I went back to New York. I was walking to and from work. I was taking the subway. At that moment, no one was wearing masks either. So COVID was still everywhere. And yet I was, without knowing it, as immunocompromised as I possibly could have been. And I was going into a WeWork, which was where my office was, and going back and forth into what was probably one of the most scary times of my life, but I had no idea what was coming. And only 5 days later, I would come back into this exact room and I would get the call from my oncologist.
And what we're looking at, by the way, is one of your last, headshots before you would hear this cancer word.
Yeah.
So to bring us back to that call, which I'm sure is something you don't really forget.
No, I will never, ever forget that moment. I was looking outside my window and I was actually I was walking home that evening. I had forgotten that my oncologist, or this person, I didn't even know he was an oncologist. I just thought a doctor was calling me. I forgot he was calling me that evening. And I had made plans to go to Trader Joe's, and I had missed my block that I typically go. And if I didn't miss it, I would have gotten this call in Trader Joe's. But something was looking out for me. I had gotten home. Again, no roommates were home at the time. I saw an unknown number come up on my phone and I remembered, oh, I'm getting my call. And I remember answering it and hearing the hello. I knew something was wrong. And I had to patch in my parents on the other side and say, hold 1 minute. I'm calling my parents. I merged the call. I had my mom and dad, myself, and my doctor. And he said to me, we have found that your biopsy shows you have lymphoma, a form of cancer. And I put myself on mute. I sank to the floor and I screamed. I have no idea what was said after that moment. I completely blacked out from any conversations. And I think the hardest part about that moment was hearing the despair from my parents, predominantly my mom, who lost all control. And to be so thrown off and set up that this could not be the case, and then to have it be the case, was the most difficult part of that entire journey.
Yeah, because it's really, life is a series of trying to manage expectations, and here you are, you've been, sort of propped up to think this is fine. Like you'd heard last that they weren't concerned, and then to suddenly get the call. So I'm so sorry that you had to experience that, and to hear the anguish of your mom, your parents on the call at the same time. I do ask people about processing. Like, did you even feel like you processed what that meant in that moment?
I did process. I mean, the word cancer has so much behind it. And I processed it to the point of like how they had to have it wrong. That couldn't have been me. So by processing, I was denying it. And I had to make a few very important, urgent phone calls, one being my brother, and then two being my roommates, and then three being my work. And so I had to process it to be able to verbalize to those individuals of what happened. But if I was to ask to recall what I said and how I said it, I would have no idea.
Right. Oh my gosh, because such an overwhelming time. And you led me right into the next question, which is, you've been through the process. You just mentioned breaking the news to these different groups of people in your life. Do you have any guidance for other people on how, I mean, it's such a big task. You're having to bear this
Mm.
burden of, oh my gosh, I have cancer. And then life is still happening and you have all these other obligations. So how did you handle it? Do you wish you'd done anything differently? Again, just general guidance for other people who are about to get into the same situation, unfortunately.
Yeah, so I am a big people pleaser, just to throw that out. So I took it as my responsibility to individually call every single person in my life who I had touched, even remotely, to share the news on a very personal level. So to say I had individual conversations with upward of 200 people would not be an overestimate. And by personal conversations, I mean, I would get on the phone, I would explain to them my situation, and I would have to recomfort them to ensure that I was going to be okay. So I was the mother to every conversation I had. So that is not what I would recommend doing, but it allowed me a community of people who, from that initial conversation, had my back every single step of the way.
That's so interesting. That is, first of all, incredible. Like, I've never heard of anyone taking that approach where you're individually having these very in-depth conversations with that many people. Glad to hear that there were some benefits there. I've heard more commonly people saying two different things. One, I delegated to so and so to break the news to people. Another would be blogging. That's what I had personally done. I didn't even intend to blog for that purpose, but it ended up being a great way to inform people without having to repeat. But it's so interesting to hear, your approach. But again, glad that there were advantages. Before we move on to the next section about treatment, there are a couple more questions. One being, I know you went through a lot of different, you had the biopsies, different ones. Did you have a bone marrow biopsy at any point?
Yes.
Can you
Yeah.
describe that procedure because a lot of people get scared about it, and then what you learned from the bone marrow biopsy?
Mm. I wonder if my version of sharing it's going to further scare people, but this is kind of the honest truth of it. So I went in, and the biopsy that I had gotten did disclose I had lymphoma, and the PET scan did show I was stage 4, but they did not know specifically what double markers I had, and that then determines the line of treatment. So I would have either gotten RCHOP or REPOC, which is a little bit more intense of continuous chemotherapy. So the second biopsy had to go forth to enable us to know that decision. And I was not prepared for the biopsy. So when I went in, my oncologist was like, we need to do this right now. And I'm actually going to do it myself, and you're not going under. So they just numbed the area, and he had to try 4 different times to actually extricate the bone marrow, which was the most painful process. And this was the day that I found out I was stage 4. So that day I'd learned I was stage 4. I was starting chemo, whatever line that would be in the next couple days. And I also learned as a female that day, I was not able to freeze my eggs on top of getting my biopsy. So it was like second worst day of my life, but definitely a not a fun process.
So much to take in, and I do want to delve into the issue you just talked about. People talk about fertility preservation, but not everyone's able to get a chance to go through that process. And so I do want to address that for our third clip. I'm going to do a deep dive on that. But with the bone marrow biopsy, so did you know at that point it was diffuse large B cell? Had they already told you it was
Yes.
DLBCL? Yes, a form of
Yes.
non-Hodgkin's. I think the most common one, actually. So, wow, you had to learn a lot that day. Any guidance for people on bone marrow biopsy? I know some people just try to like mentally transport themselves to another place. Did anything help, or was it just like, oh my gosh, I wasn't prepared for this?
The best advice I can get is, or give, is it's short. It doesn't take a long time, and once it's over, it is the most important part of your journey because it will determine so many things. So, yes, it's grueling, but if you can handle those first 10, 15 minutes, and that's even longer than the actual process, it is all okay after. It's just a matter of taking it step by step and knowing that this is going to help you in the long run.
Perfect. Thank you, Nina. And my last question here is, had you considered getting another opinion? I guess technically you did get two opinions, right? You were at Langone in New York, and then you were at, was it Penn Medicine?
Yes.
Had you, it even crossed your mind to get a third or anything like that?
Yeah, so my dad being in oncology was a incredible resource. So we were able to get many opinions on if this line of treatment is the correct version, what is best for me in terms of how I'm going about this process and making sure every T is crossed and I is dotted. So we did have multiple people look over my PET scan and form of treatment.
Perfect. It just feels good to have all the information, right?
Yes,
Awesome.
always.
So for everyone, we're going to shift over to the second clip now with Nina, where we talk about the chemotherapy, the side effects, and the management. So hang tight.